Dr. Toby Moma, your host on health and wellness. What a pleasure to have you on the show. Don't touch that dial. We have a great show with Dr. Shrina Saxena. She's a public health candidate. She's a physician. She's Indian born, Russia trained American immigrant. Married for 4 years and visiting us with her specialties, public health, and her initiatives in that public health arena. She's done a lot in the area of educating women in prenatal counseling and ensuring that men and women know more about vaccines, especially for concerning their children. We want you to listen as we delve deep into the purpose and plan for her medical course in life. She trained in the university in Russia. She moved here in 2015 after working for about 4 years in India, and she came here, worked in some parts of the United States. She lived in California, lived in New York, then moved to Miss Louisiana, and she's cut her teeth in public health. She's currently doing a 2-year master's in public health program at the Louisiana State University, Shreveport. So she has a wealth of experience, and I believe it will be a blessing to you today. Listen and be blessed. Welcome on the show, Dr. Shrina.
No.
Real honor having you on the show. So I just was asking, what inspired you to go into medicine? What was the spirit? What was the reason? Because medicine is a calling. I know it's a vocation, but if you're not called to it, it's hard to continue doing it for a long time because it can kill the number of sick people you see, the trauma, the outcomes are not always positive. So what made you go into medicine?
I knew that I wanted to be a doctor when I was like 14 years old, and part of it was because I've heard stories about my grandfather from my mom's side being a great surgeon, great doctor, and how he was like practicing for the till the last day of
Your
his
grandfather.
from my mom's side.
Wow.
Yeah, he was a surgeon. He in those days, I think it was back in 1920s. The surgeons and the medical doctors, they received a combined degree. So he was a surgeon. He was a general physician. So I've heard a lot of stories about how he used to help the people around him. Second was my dad. My dad had a great impact on the kind of personality all three of us built because we saw him helping so many people in so many ways. He was a criminal lawyer, but at the same time, he was an advocate uh, of peace and stability in families. So he used to help out families who used to come to him no matter in what respect, like robbery or dowry deaths or domestic violence. He used to try to help those families out. And I've seen him counsel a lot of family people in a way that changed their life. So I knew that I wanted to do something when I can make a difference, when I can make a difference in the community, in even in one person's life. That would be quite an achievement. So I knew that I wanted to become a doctor, and I love what I do. I
So
love
why Russia? Why did you go all the way? There's a lot of great medical schools in India. Why you called it Slovak or
Smolenska
Smolenska Medical Institute or
Medical Academy. Yes,
Medical
sir.
Academy, right?
It had a good name in the city I was staying. That a lot of students have gone there, and they had a good knowledge about medical field, and that academy was very very renowned. It had a good name, not just in Russia, but we had students from all over Asia and even Europe and Middle East who were there. Like we had like 1,200 something students, only foreign students. Our
Wow.
foreign medical faculty was different than Russian medical faculty. So only 1,200 students which were from, and there was majority from India, but they were from Bangladesh, Arab, Saudi Arab, Afghanistan, Pakistan, a lot of people from Nigeria, Ethiopia, and all those great countries, and even from Europe. So
Wow.
it was a big name there. So I was fascinated by that.
Mm, that's awesome. And what was the infrastructure like at the school? I mean, they had everything you needed to train as a medical doctor, as
Yes.
good as you find in the American medical system.
Yes, I would say that the quality of training was good. It was very nice, and the infrastructure was like we foreign students were placed in three different dorms, and we were not allowed to have cars or personal apartment complexes. We were supposed to stay in campus because it was kind of not safe for us staying when we were beginners, when we were freshers, to stay in Russian communities. What if we don't understand what the person in front of us is saying? Because every country has their good side and bad side, and what if we fall in the trap of people who were not so good? So because they wanted us to be safe, we were supposed to stay on campus, but we loved it. I mean, we used to have all the festivals we enjoy. We
What
were
kind of hospitals did you rotate in?
They were mostly public hospitals. Now, Russia has universal insurance, and everything is under governance of the government center. So everything is public. Mostly, like 99.999% is public. So I personally rotated in like 6 different hospitals, which were on the periphery of Smolensk, like the city, and there were 3 main ones which were in the city. So we had different rotations everywhere. But first 3 years were non-clinical: pathology, pharmacology, biochemistry, and all those subjects, basic subjects, and anatomy and stuff. So those were all the classes and rotations were in the university. But apart, when we went to next 3 years of our studies, which were non-clinic, which were clinical, then we had to rotate in different hospitals, and it was beautiful. Everyone, maybe it may be a CEO of a company, he's in the same ward, hospital, same room as anyone
Wow.
anyone else.
So, did your high school play any role in you pursuing medicine? The private Catholic high school you went to,
Yes.
how did it do that?
In general, our high school was very supportive for any women, any girl who wants to.
So, it was
Uh,
an all girls high
it
school,
was all girls high school. So now, our IBMV was started by Mary Ward,
an American, a British,
British,
Scottish,
Scottish, Iceland.
Scottish,
So she was from Iceland. Tra-
Iceland,
sorry,
Ireland.
Ireland,
Okay.
Ireland. I'm sorry. So she traveled, and later on, Catholic community accepted her as being her as being her. What she was doing was instrumental, because she was saying that through education we can uplift the women, spread awareness, and help them take ownership of their life, and that is exactly what their motive is till date. They are all girls' school, and the quality of education is very good.
You call
And
her, what's her name, Gardner? The lady who founded the school.
Mother Mary Ward,
Maury Ward, okay.
Mother Mary
Do,
Ward.
does India have a problem with women physicians?
Women physicians. Women physicians actually are growing. It
Okay.
is. I would not say that majority of the doctors are women, no, but I would say there's a big chunk of doctors in India who are women, and majority of OBGYN and majority of pediatricians, they are all girls in India, and people prefer having them. So, yes,
Currently, the University of Mississippi is predominantly female
female.
in terms of the student population.
Yeah.
So, what would you say to that patient who says, I don't like seeing female doctors? I don't want to see a female, I want to see a male because they tend to be more professional, they know their onions better. What would you say to that individual who thinks women physicians are less intuitive or knowledgeable than their male counterparts?
See, everyone is good at everything. I mean, everyone is good at something. So maybe the male counterpart is good at something, but it is not that women are not absolutely good for nothing. I mean, there is no generalization to this part. And I personally know so many female doctors who are absolutely stellar in what they're doing in terms of research, in terms of the aptitude towards patients, and they have done some remarkable jobs which sometimes don't even get recognized. I mean, there's a complex patients who sometimes it is difficult to diagnose them. It's not about just about female and male, and people diagnose them, they treat them, and after that we pat our own back and say, okay, we just solved a big mystery. And those small little things, everyday things, don't even get recognized. So doctors in general work very hard. uh, just keep the money part aside, but there is there is a lot more to what we every healthcare professional, not just doctors, we sacrifice, and that should be appreciated irrespective of the gender. I
I
do
agree.
not
I
think.
agree totally. The chief executive of my hospital is a female. My chair is a female. I work with the best. I mean, the colleagues I work with are predominantly female. So anybody who says female physicians are less or not as educated or knowledgeable as males doesn't know what they're talking about. Because I know some female physicians who know a whole lot more than I do,
Yeah.
and I'm proud of them. Okay. So in your class, what do you think? Were there more females, more males, or equal
And we had, I can tell you exact
in your
number.
medical class, right?
Yeah, I can tell you exact. We were 36 girls, and we had a class of 108. So how
Okay.
much is that?
So more
70
males,
something,
right?
70 something boys.
Women still get celebrated when they achieve something in America in the medical field. People still think it's a predominantly male-dominated arena. I don't know if that's still true, but the fact is when a woman achieves something and they make it look, oh wow, this is awesome. The question is it because she's a female or is it because she achieved something really remarkable? What I'm trying to say is that we should not
Be biased.
consider a woman becoming aspiring for the highest office as a misnomer. I think the normal should be equal opportunity for equal people. Am I correct?
Yes, you are absolutely right about that. There should not be any disparities based on gender, color, creed, anything. It's not about even gender. There is a lot of discrepancies which are prevalent in American society and way more in Indian society. But I don't think the future generations, the millennials, should be biased or be judgmental or have a disputed opinion based on all these things because they are very, very superficial. So.
Tell me about your opinion on gun violence. I mean, what's your opinion on that from a public health perspective? We've heard a lot of stories about gun violence in America. Does that happen in India? Are there gun laws that restrict owning guns?
Yes, for the first time when I moved to Louisiana and I saw a person walk in a doctor's office with a gun. There, he was definitely a law enforcement person, but when I saw that, I was very, very surprised because that doesn't very regularly happen in India. In India, they have everyone is supposed to have a gun license. It's as much regulated in as much it is in United States, but I later on with my staying here and getting to know the community even better for last 3 years I've been here, I realized that keeping a gun for some of the families is a cultural thing. They grew up um, seeing their fathers and grandfathers going hunting and having a collection of guns, which I think is amazing. It's just a hobby, but guns getting in wrong hands is where the problem is. How that will be regulated, there is no black and white, no yes and right, yes and no to that answer. That I personally I do not know how that can be controlled because even it's not even gun. If say a knife goes in the hands of a wrong person who is on pills, who is
Right.
mentally depressed, uh, he can just stab anyone left and right. So it's wrong thing going in wrong hands, and what we can do about it is dealing with mental health issues. That's the
Right.
bottom line.
What can we do to help build the health infrastructure in America from your point of view? I mean, there are places in America where people still don't have access to medical care, just like in India, just like in Africa. If you were the World Health Organization Director General, what would you do to help improve access to care and
Yes.
availability of physicians to those who really need them?
I personally feel yes, American system is very disciplined. It's very organized, but at the same time, it is very expensive. That's the bottom line. It's very expensive for people who are lower middle class and lower class. It is just impossible for them to have quality care services because it is so complicated to understand the whole system, like what insurances you should have and what PAs are, sorry, what prior
Prior
authorizations
authorization.
are, and which medicine will be covered and not, and then people come around and sue you and everything, all those things, they are little less in other countries. And I think one solution which has been there for a long time in other countries is universal insurance, like it is in UK or Canada. I think that could probably solve. I don't know if Obamacare is something close to it, but universal insurance is where everyone will get free services no matter which socioeconomic strata we are from. So I think that can solve this problem.
What has India done to help reduce the health disparities?
In India, there's a lot of public hospitals.
But they don't have universal health care.
We do not have insurance. I mean, imagine how complicated it would be to to centralize so many people. It's there in India, the
And I think
population.
that's the same question people are asking in America. If we introduce United Universal Health Coverage, who will pay for it? Because Obamacare, there was a big deficit in the budget,
Hmm.
trillions of dollars. So a lot of people's argument is, who's paying for
Who is
this?
going to
You
pay for
know,
it?
are
Yes.
we paying for people who don't want it,
Hmm.
who don't care about their health, who misuse it? You know.
Yes.
So
They
the
are
question
definitely
is,
that.
can the government afford it, basically? So I think the reason why India hasn't started universal health care is because it's hard for the government to
Finance.
afford it. Yeah, it's
Yes.
hard to finance it. So those are questions that, you know. Tell us about your current projects at LSU Shreveport, Louisiana State University. What are you currently working on?
Well, currently, I'm working on the vaccination because, like I said, I had a conference in Jackson State University about maternal health and prenatal and
Very
preconception.
good.
So that is my that's my biggest concern, and because the deaths related to vaping is increasing,
Weight
vi-
gain?
vaping
Vaping, okay.
vaping is increasing. We had a small session last month when we were discussing about all that, and that's really concerning because vaping is something which is growing like a light. It's growing at a very rapid speed.
So vaping is not an alternative to smoking. It's just as bad as smoking. I would not recommend it to my viewers.
At
Highly
least,
not recommended.
at least wait till there's enough studies related to what it
Putting
is.
anything that has smoke in your mouth doesn't sound very healthy,
Yes,
in my view.
yes.
Okay, but so what do you think you're gonna do when you graduate, going forward? I mean, what's your graduation project on? What are your plans after graduation?
After graduation, I want to come back to clinicals and also global public health. I want to keep sticking to both and work for the community in every minutest way I can. And that's I think is one thing which I think that this part of United States, Mississippi, Louisiana needs a lot of help. They truly, genuinely need a lot of help. If I am as small as I am, if I am able to make a difference in even one family, one person's life, I would think that's a blessing, and I want to keep working on that.
Now, I think there are about 3 million Indians in America. Am I more? Are there
No,
more?
more than that.
4 or
Yes,
5 million?
yes.
Okay. And they've become very influential. The other day they had a reception in Houston for the Prime Minister Modi,
Modi.
and the president was there.
Hmm.
So what have they done? This Indian population in the diaspora. What have they done to become so influential that the president of the United States comes and attends their reception for their prime minister? I mean, what are the things that you think the Indian population has done that other
Mm.
populations can look at and follow?
Like President Trump said during that rally, that Indians are good, civilized citizens of United are turning out to be good citizens of United States. They pay their taxes. They are creating more jobs for other people around them. They are not intentionally doing any harm or doing anything which is against the law. So I think that is what
Like
people.
the Now Save was an Indian
Yeah,
gentleman. That's the gas station.
gas station.
So there's a
So
lot of Indians in the
employment,
local Monroe area
Monroe area,
who
yeah,
have done a lot of business.
business. So that is creating jobs for, according to
Mm,
him, and President Trump also. And even in healthcare industry, a lot of Indian doctors are doing a fantastic job
mhm.
in every field, not just medicine but surgery too. I feel that that is the biggest contribution of our community, and we continue to do that.
So part of being, if you want to be part of a community, you have to be involved.
Like I said, cultural quotient.
Right.
Honestly believe that cultural quotient plays a big role in a part of an immigrant's life. I decided to move to in America, and it should be my top priority to sink in. I I'm here out of my choice, and this is the culture which the local community follows. There is no question that I should not acclimatize myself to the local culture, and I enjoy that. And that's how you enjoy being, because we don't have a lot of family and friends around, because our
Right.
community is back in India, and that's not even my fault. I grew up in India. I spent 24 years of my life singing national anthem of India, reading about Indian national politics. So that part of that India remains a special place for me, obviously, and that Indian can nobody can take that out of me. But since I decided to move to United States, I should have a good CQ.
Right. Talk to me a bit about the polio epidemic. The World Health Organization has just declared that they've eradicated polio strain 2 and 3. There's only 2 countries in the world that
Still have.
currently have wild strains of polio. Nigeria hasn't had a wild strain in 3 years. Afghanistan and
They're
Pakistan
the two
are
countries.
the only 2 countries. So India has been free, right, for a
Hmm.
couple of years now. So
Yes.
what can Pakistan and Afghanistan learn from the rest of the world? How do they eliminate polio? For my audience who don't know what polio is, can you give them an understanding of that disease?
So polio is a very, very debilitating disease, I would say. It is a viral disease, and it is around us in the form of dormant forms and wild forms. If contracted, it will cause severe disabilities, like you will have hemiplegia or not working limbs or deformities of the bodies. So it is associated with a lot of debilities, this is how I put it together. And there is a vaccine to prevent polio from happening, and that is recommended for all the kids at certain ages. Through that vaccination, this is a critical time when the whole world is at the verge of saying that, okay, we are done with polio. Polio will be in small little petri dishes in some museum. Those viruses will be stored, and that's it. We are like smallpox. So in India, I know that when I was growing up, in our television channels, there was a very, very famous person from our film industry who used to advertise polio vaccine. And if a person is literate or not literate, no matter how educated you are going to watch TV. And when you watch TV, that is the very, very strong medium to spread awareness about vaccination. And I think that is how India is where it is right now in terms of polio, because it was advertised by a very, very influential celebrity, and people started taking him seriously. So
So you think Pakistan and
they should advertise.
Afghanistan need to
Advertise awareness. Yes.
create awareness and encourage their local population to
Get vaccinated.
get out and do that too. So, yeah, if the world can eliminate polio like they did smallpox, it'll be a huge triumph. And Nigeria 3 years ago decided to, with the collaboration of Bill Gates,
Oh
Melinda
yeah,
and Bill
he
Gates
is. Yeah.
Foundation, they basically got the stakeholders, the traditional rulers, the religious rulers, and said, we want you to talk to your people to get the vaccine.
Yes.
And we haven't had a polio outbreak for 3 years, and it's put Nigeria back on the world map.
Wow.
Not for the wrong thing now, for the right thing.
Wow.
So I think it's something that we can all learn from.
Don't learn.
And there are other conditions. There's Ebola currently that is ravaging Congo and I think parts of mostly in Congo. It's killed almost 3,000 people this year.
Ebola, yeah.
Ebola. And this is the good news. They just licensed a vaccine from Merck for Ebola.
Oh
And there's
wow.
currently a vaccine for malaria, which
Oh
is
wow.
effective in 50 to 60% of the population. But what am I trying to say? Vaccines are the new normal.
Yes.
We are developing vaccines for Ebola, we're developing vaccines for malaria, we're developing vaccines for every condition because we don't want you to have to come into the hospital and get treated if we can prevent you from contacting the disease.
Yes.
So I think if there's anything Dr. Shrina and I have been pursuing and trying to instill in your mentality is that vaccines are not a bad thing. Vaccines are your friend. Vaccines are designed to keep you out of the hospital. Vaccines prevent disease. They don't cause disease. If they cause, it's maybe one irritation where they give you the injection, maybe one or two pain, but in the long term, the benefit of that vaccine outweighs whatever risks there are. And I think any one of you listening to me today and Dr. Shrina will go home with that message. Get vaccinated. Get your flu shot. Get your pneumonia shot. Get the shots that your doctor recommends for your child. It could save their lives in the future.
Yes.
I'm Dr. Toby Moma. I'm the host of this show. And I'm telling you that what we've shared with you today are life-changing nuggets that if you implement them will put you on the pedestal to sound health. 1 John 3 verse 2, the Bible says that I wish above all things that you prosper and be in health as your soul prospers. God wants you to be in health. This show's motto is to keep you in health. Join us same time next week. Join us at our Holy Ghost night, November 22nd, Clarion Inn, 11 p.m. It's called, the theme is Overcoming by Faith, the faith that overcomes the world. Evangelist Green and her husband from City of Spirit of Deliverance Church will be ministering. Look forward to seeing you there. God bless you. Jesus is Lord.